Maybe COVID-19 is the dry run we needed, the fire drill to wake us out of our complacency and to reform the food system before it's too late.
Hey everyone, this is Dave Coman-Heide. I'm the president of the Humane League, and today I'm joined by Dr. Greger, who's a physician and specialist in public health. He literally wrote the book on how to survive a pandemic, and today I'm going to be asking him some questions that I know have been on all of your minds. So Dr. Greger, can you tell our audience a little bit about your background in researching zoonotic diseases and pandemics?
Yeah, actually, most of my background, the first half of my professional life, was dedicated to infectious disease, emerging infectious disease. Actually, most of the articles that I've published in the peer-reviewed medical journal have been on this very topic. And I only shifted to studying lifestyle medicine once people just kept ignoring the message. I was talking about the threat of a pandemic viruses. No one seemed to care. No one seemed to listen. And so I moved over to what was killing most Americans from 1919 to 2019 for the last 100 years, every single year. Heart disease is killing more Americans than any other disease. I was like, all right, until people are interested in pandemics again, I'll switch over. But always in the back of my mind, remembering that the reason that heart disease wasn't the number one killer in 1918 is because there was a flu pandemic.
Dr. Greger, can you explain to our audience exactly what a zoonotic disease is?
A zoonotic disease is a disease that jumps from animals to people. So, for example, rabies is a zoonotic disease, but dead ends in the host. Only one person gets rabies and potentially dies unless they're vaccinated. But there are some zoonotic infectious diseases that once they jump from animals to human, they can then transmit human to human. And so, in one sense, it doesn't matter what we eat. Once a virus goes pandemic, the risk shifts from eating to breathing. On the other hand, what we eat as a species is all that matters in terms of preventing the next pandemic.
We've been hearing a lot about bats and pangolins in the media because of COVID-19, but already we've seen since the outbreak of COVID a new strain of avian influenza break out in farms in the US. And we see the threat of future pandemics right here in our country, thanks to massive amounts of chickens on factory farms. You brought up swine flu. I remember being in college when that broke out and knowing many people who got it, including myself. What have we learned from those outbreaks that we've seen and our current system of the factory farming? What are the risks that are created from our current system?
Yeah, well, over the last few decades, hundreds of human pathogens have emerged at a rate unheard of in the annals of human history. You say, wait a second, emerged from where? Mostly from animals. The AIDS virus is blamed on the butchering of primates and the bushmeat trade in Africa. Mad cow disease was because we turned cows into carnivores and cannibals. SARS and COVID-19 have been traced back to the exotic wild animal trade, but we domesticated pigs and got whooping cough, domesticated chickens and got typhoid fever, and domesticated ducks and got influenza. Leprosy came from water buffalo, the cold virus from cattle or horses. How often did wild horses have the opportunity to sneeze into humanity's collective face until they were broken and bridled, right? Until then, the common cold was presumably only common to them. And in fact, this explains why European diseases wiped out the Native Americans and not the other way around. Why didn't American epidemic diseases wipe out the European colonizers? Well, it's because there were no major infectious diseases in the Americas because, look, we had the North American camels got wiped out in the last ice age, so no smallpox. We had buffalo, but no domesticated buffalo, so no measles, and on down the list. And so the only way we're going to prevent the emergence of future pandemics from livestock is really the de-domestication. We really need to move away from animal agriculture to prevent the spread of these herd diseases, these infectious diseases that can affect large numbers, from jumping from the animals that we raise for food to human populations. According to the CDC, the leading candidate for the next pandemic is a bird flu virus known as H7N9, which is 100 times deadlier than COVID-19. Instead of 250 people die, H7N9 has killed 40% of the people it infects. The last time a bird flu virus jumped directly to humans and triggered a pandemic, it caused the deadliest plague in human history, the 1918 pandemic, which killed 50 million people. Right? That had a 2% death rate. What if we had a pandemic infecting billions, where death was closer to a flip of a coin? Right? But the good news is there's something we can do about it. Right? Just as eliminating the exotic animal trade in these live animal markets may go a long way towards preventing the next coronavirus pandemic, reforming the way we raise animals for food may help forestall the next killer flu.
What is it about the conditions on these factory farms that's such a breeding ground for disease?
The unprecedented emergence of H7N9 and 10 other bird flu viruses newly infecting people all around the world has been blamed on industrial poultry production. When we overcrowd thousands of animals, these cramped, filthy football field-sized sheds to lie beak to beak or snout to snout atop their own waste, it's just a breeding ground for a disease. Right? The sheer number of animals, the overcrowding, the stress crippling their immune systems, the ammonia from the decomposing waste burning their lungs, the lack of fresh air, the lack of sunlight. Put all these factors together, and we really have is kind of the perfect storm environment for the emergence and spread of new kind of super strains of influenza. These so-called factory farms can be thought of as a public health menace. No wonder why the American Public Health Association, the largest and oldest association of public health professionals in the world, has called for a moratorium on factory farms. No more factory farms. Maybe COVID-19 is the dry run we needed, the fire drill, to wake us out of our complacency and to reform the food system before it's too late.
Why do you think these factory farmers, major meat production companies aren't making the necessary changes to protect public health?
Well, I mean, in some ways, major meat producers are helping to innovate us out of this precarious situation. Tyson, Purdue, Smithfield, Hormel, Cargill have started producing either blended products with animal proteins or completely plant-based lines, but still there are necessary reforms to be made in factory farming. So, for example, look, we need to give these animals more breathing room. They're the ones who could use a little social distancing right now. Right? One study showed that measures as simple as providing straw bedding to pregnant pigs so they don't have the immunosuppressive stress of lying on bare concrete their whole lives can significantly cut down on swine flu transmission. Right? Public health community has been shouting from the rooftops, but we don't tend to kind of shore up the levees until after disaster strikes. The bottom line is it's not worth risking the lives of millions of people for the sake of cheaper chicken.
Yeah, completely on the same page with you there, Dr. Greger. I'm curious, you've covered some of the systemic changes that you think might help prevent a future pandemic. What do you think we can do as individuals to help be part of that change, to help prevent future outbreaks like bird flu that becomes highly pathogenic in people? Is it as simple as ending the abuse of animals raised for food?
Well, in this new kind of age of emerging diseases, there are now billions of feathered and curly-tailed test tubes for viruses to incubate and mutate within billions more spins at pandemic roulette. We may be one bushmeat meal away from the next HIV, the next one, pangolin plate away from the next killer coronavirus, and one factory farm away from the next deadly flu. But along with human culpability, though, comes hope. If changes in human behavior can cause new plagues, well, then changes in new behavior can prevent them in the future. That can start with our meals day to day, what's at the end of our fork, and we can support amazing organizations like the Humane League, which are fighting tooth and nail to make animal agriculture safer for humans, more humane for animals, and moving away from animal agriculture towards plant-based alternatives, which are healthier from a human's health standpoint, from a planetary health standpoint, and from a global health standpoint in terms of pandemic risk. In How to Survive a Pandemic, I try to cover everything there is to know how to protect ourselves and our families from the coronavirus, optimal respiratory and hand hygiene, surface disinfection, everything from masks to how to make your own hand sanitizer. But the best way to survive a pandemic is to prevent it in the first place. And that's why the bulk of the book really centers around tracing the origins of the COVID coronavirus and what we can all do to prevent even greater infectious disease threats in the future.
Thank you, Dr. Greger, for breaking down the science of pandemic risk for all of us at the Humane League. If you out there are watching this and you want to be part of this change, if you want to get involved with the work of the Humane League, go to thehumaneleague.org and click on Take Action. It's never been easier to get involved with our campaigns. Right now, we're campaigning against major meat companies like Tyson Foods in demanding that they do more to protect public health, to end some of the worst abuses on their farms, but we can only win this campaign with your support.